All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is the most important topic today within the autonomic nervous system because as we see the dysfunctions of the autonomic nervous system, we'll be using this topic to understand the functions of it. And to understand the functions, let's just have a very simple statement in our mind. That is, if a lion is chasing you, not in the zoo, but it is chasing you in a jungle maybe, what will you like to do and what will you not like to do? Would you turn around and spit on the lion to protect yourself, or would you run? So that is the kind of question. And if you keep this in your mind, then all the functions that you would hear for sympathetic or parasympathetic, they would start falling in place. I have to contain myself today because I am so excited about these topics, especially around neurology, that I can go on for longer time. So I'm going to try to do it in a shorter period of time. However, it is a very important topic. So let's start. So there is a lion, and lion is chasing someone. What is the behavior their body should do? What? That is one. And the second, opposite to that, there is a person who has recently eaten food. What should they do? Should they start running around, or should they start sit down and let the food be digested and the energy be taken and stored? These are the two opposite things, and one is sympathetic and one is parasympathetic. Let's start with the eyes. Eyes is the most complex one in this one. The rest is all very simple. So look for the sympathetic system. You are running, the lion is chasing you. You do not want to stop and appreciate a beautiful flower. You have to run. So you have to be able to look far. That means your eyes have to be set for the far focus, not for the near focus. Now, for the far focus, for the far vision, what you have to do is somebody said belly rub the lion. That would be a good idea as well if the lion lets you belly rub it. Okay, so this is an eye. In the eye, in the near anterior part of the eye where there is pupil and the lens, the structure over there is that on the, imagine eye being a ball, a sphere. In the sphere, on the edges of the sphere, almost one third the way back, there is a structure called ciliary body. Imagine inside a bulb, there is a structure, rounded structure like a ring. On that ring is a muscle attached, which is also ring like muscle. That is called ciliary muscle. With that ciliary muscle are attached another set of fibers, which are called the dilators. They are actually muscles as well. They're called dilators of the iris. And then inside, very much around the pupil, the black that we see in our eye, that is the constrictor of the iris. So, three: outer ring, then dilators or fibers, sort of vertical type fibers, and then ring fibers again. This is the structure. So if you look at this eye from a side, what will happen is normally this is the ciliary body and the ciliary muscle, a ring. Attached to the ring are the dilator fibers. Attached to the dilator fiber is an internal ring that is around the lens, and this is the constrictor, and then the lens itself. Now, if we are running, we want our lens to become flattened so we can see far. We do not want the lens to become globular and we see near. So, how do we make the lens flattened? We have to stretch this structure upwards or outwards. So, to stretch this, what happens is, then these are complex phenomena. There are multiple people's theories. We still do not understand exactly how this works, but there are many, many theories, and some are more accepted than others. So I'm just going to take a generic theory here. What happens is the ciliary body, the ring that is on the eyeball, that ring moves backward, and the muscle, ciliary muscle, relaxes. When it relaxes, it moves outward, which causes a pull on the threads, and the threads are connected eventually with the lens, and the lens gets pulled and from all direction it's a circular thing, and it becomes flattened. This is the simplest way I can describe it. This mechanism is quite complex. So, anyways, now what happens is we are set for the far vision. So, imagine what will then the sympathetic system do. Sympathetic system will cause relaxation of the ciliary muscle. When the ciliary muscle is relaxed, imagine my whole head is the eye. When the ciliary muscle relaxes, it moves backward. When it moves backward, it stretches on the fibers, which then stretch the lens, and it becomes flat. So ciliary fibers muscle relaxes. On the other hand, if we are in a parasympathetic state, we are sitting down with someone we love and we are having food. We want to look close. So we want the lens to become more globular so we can have a focus near focus. So for that, what we do is we contract the ciliary muscle and ciliary body is pulled forward. When that is pulled forward, the tension on the lens reduces because the dilator fibers do not have a tension on them from ciliary muscle. Ciliary muscle is not pulling them outwards anymore. And when the tension relaxes on the lens becomes more globular and we develop a near vision. Of course, there is near vision done with the sphincter as well, the inner circular muscle that can do that too. So for parasympathetic system, those muscles that would make the lens globular for the near vision, they function. So ciliary muscle would contract, sphincter would contract. Good. And this is why. So look, we have one more thing over here. When the pupil is dilated, when we are set for far vision, our eyes somehow look prettier. Because of that, women in the older time used to put drops that we use today for our eye examination. They used to put drops in their eyes that would dilate their pupil. They would not be able to see closely, but they would look prettier. That is why, because they cannot focus near on the near vision anymore, they would not really care who's there. So they look pretty, but it doesn't matter who is in front of them. So that is the eyes control. Sympathetic system far vision, parasympathetic system near vision. Sympathetic system would help you run away from the lion. Far parasympathetic system would help you sit down and eat your food. Okay, continuing. So the whole discussion, please keep in mind, will this action help me eat my food and digest and store, or will it help me run? One or the two. Sympathetic would help you run, parasympathetic would help you sit down and eat your food. Okay, so now we are talking about the glands. Now think about it for a second. If you are running away from a lion, do you want to have spit? Do you want to turn around and spit on the lion and hope it would go away? Do you want your GIT to start becoming active and start having secretions? And maybe one person starts having diarrhea or vomiting. Is that a good time for that? No. Is that a good time to urinate? No. So, if we look at the sympathetic system for glands, sympathetic system, when we are under fright and flight, most of our glands would reduce their activity, except the sweat glands will start sweating. But other than that, the lacrimal gland that make the tears, the parotid gland over here, the submandibular glands over here, then pancreas, their secretions would actually start reducing. So lacrimal gland, nasal, parotid, submandibular, their secretions are reduced. On the parasympathetic side, their secretions are increased. And please remember, gastric and pancreatic juice is the same way. Parasympathetic, you're sitting down and eating food. What do you want in that case? You want more secretions. You want saliva to come in. You want gastric juices to be released. You want your secretions to increase so you can digest the food. You can emulsify the food. You can make it liquid. You can chew it, then you can digest it. But that's not a great time when you're running away from a lion. Now, How about the sweat glands? How about the skin? So, skin has a very interesting behavior. Once again, let's keep one thought in our mind. In the case of sympathetic system, we are running away. We want all of our energy to go to muscles and brain. We want nothing else to function at a higher level. We want brain to function fast, and we want muscles to function fast. So you would see that our body is going to try to stop other functions or reduce other functions so that it can direct energy towards the muscles and brain. And in the parasympathetic system, you would see that body is going to try to bring blood to the gastrointestinal tract, to the GIT, to our gut, so it can pick up the food you are eating and it can store that. So in parasympathetic, we'll take energy away from muscles. That's why you start relaxing. In sympathetic, we're going to start taking energy away from the gastrointestinal tract. So here, how about skin? Number one, skin itself will contract in sympathetic system. Number two, the hair on the skin, they will erect, they'll stand up. This is why we say, well, my hair stood up. Why? The goosebumps that they develop, there is a muscle called piloerector muscle. Piloerector muscle contracts in sympathetic system, and our hair stand up on their edges. Why do they do that? This is actually a remnant from animal time. If you see the animals like chickens or others, when they are afraid and fighting, they kind of puff up and they make their feathers stand up and they look bigger. So for us to look bigger, we kind of do this. Look at my posture. We kind of try to look bigger by extending our arms and making our legs wider and so on. But we also have a kind of a rudimentary way of puffing up, and that is having our hair stand up. So in sympathetic system, we want to puff up. And how do we puff up? By the hair. There is another concept here as well, and that is in cold when we puff up. It is not to scare someone. It is really that we want to trap more air in that want to create a layer of air around us, trapped in those hair that have stood up, to give us a little more comfort, and temperature dissipation is reduced. So question, sympathetic, what would happen to the hair? They would stand up. How would they stand up? Because of the piloerector muscle that would contract. In addition to that, there are two, three types of glands in the skin. So there are eccrine glands that make sweat. So we will actually sweat more. So eccrine glands would become active. Why would we sweat more? Because we want to keep ourselves cool while we are running. So sweat is a way to keep our temperature under control. So body knows that you're going to rev up your engine and run. And so it is going to make some sweat, so that sweat would evaporate and we will cool down as we are making and using energy. Then here, with the hair, there are two more glands. One are called the sebaceous glands. These are the glands, and these are the areas which become infected and we get those acne like things. Sebaceous glands, and we also have apocrine glands. These have more non-sweat like thicker lipid based fluids in them. When these two come out, the secretion from sebaceous gland and the apocrine glands, they fuse together, they merge together on the skin surface, and when they become uh, um, merged with bacteria on the skin, they create an odor. And sympathetic system causes odor. You may have noticed that sometimes people who have been angry, they start smelling. Or somebody who's been under stress, they would notice that, hey, my shirt is smelling more than usual today. Or people would notice that whenever they're under stress, they have more smell from their body, the odor. That is actually also a way for us to say, you know what, I am a big guy and look how I'm smelling bad, I'm gonna be bad. So all these glands are active. In the parasympathetic system, the only place where the sweat can appear is the palms of hands. That's it. So when you are eating food, you don't want to be sweating, and you don't want to spend energy on sweating. Correct? And you're not really making a lot of temperature you're not increasing your temperature. When you're eating food, you actually move blood away from muscles and skin into the GIT. So skin is already cold because it doesn't have sufficient blood on it. You don't want to have sweating going on to make it even more cooler. So no sweat during parasympathetic system, or less sweat. Now this is very important. Blood vessels. So very simple idea. In the case of sympathetic system, what do we want to do? We want brain to be more active. We're running away from a lion. We have to think about climbing up stuff very fast. And we want the muscles to be active. So what happens is that those blood vessels that are supplying the brain and the muscle, they would start dilating. They would start bringing more blood to these structures. But the blood vessels that are going through the GIT, for example, are gut, they would start constricting. We do not want gut to take blood from us when we are running and start working. We don't want the gut to work at all. We want it to stop. This is why, and this would actually be true for urinary system as well. This is why sometimes you feel that, hey, I need to urinate, and then some stressful thing happens or exciting thing happens, something that triggers sympathetic system, and all of a sudden you forget about urinating, and you go on for an hour or 2 hours and there is no feeling. And as soon as that activity finishes, that excitement finishes, all of a sudden you need to urinate again. Why? What happens? Our body relaxes the urogenital system, so the bladder is not pressing you to go urinate. Our body causes GIT to reduce its activity, so the blood and the energy is not spent on the GIT movement. So sympathetic system, we're running away from a lion. That is not a great time to take a poop. That is not a great time to vomit. That is not a great time to have GIT move and digest the food. We do not want those things to happen. So what will happen in sympathetic system is that there will be blood vessels that are dilated, but they are for muscles and brain like things. And there are going to be blood vessels that are constricted, and they would be for GIT and bladder and so on. Kidneys, blood flow reduces, urine output reduces. Good. Now, of course, the parasympathetic is mostly on the opposite side. However, parasympathetic usually doesn't do too much to the blood vessels. If it dilates some blood vessels, these will be the blood flow to GIT increases. Blood flow to muscle and skin can mildly reduce. Good. It's all very logical. So if you see here, systemic arterioles, these are tiny arteries of our system. They control our blood flow, blood pressure. Abdominal viscera constricted. We do not want the blood to go to abdomen or visceras. Muscles, some constricted and some dilated. And we can understand some muscles do not need to work. For example, GIT muscles should not work. And some muscles need to work. For example, skeletal muscles that are helping us run or maybe punch the lion, they are working. Skin blood vessels are constricted. We do not want skin to have too much blood on that, because that would cause too much dissipation of energy and take energy away from the muscles. So that is blood vessels. Heart, sympathetic system. And these are the dysfunctions we are seeing nowadays with the COVID in some cases, where there is blood pressure alterations, there are cardiac systems behavior that are changed. And here are some targets of sympathetic and parasympathetic system and their function. So heart with the sympathetic system. What happens is, so let's say this is a heart. On the heart, where the superior vena cava enters the right atrium, at that margin there is SA node, sinoatrial node. That is the node that is producing cyclical beats for the heart, that is producing the signals for the heart. What happens in sympathetic when we are running? What happens to our heart? It becomes increased. Epinephrine, norepinephrine can increase, double our heart rate within 3-4 seconds. Like for the cars, we say 0 to 60 in 5 seconds. Our heart can go from 70 to 150 in 2 to 3 seconds under the influence of the sympathetic system. And who does that? The SA node, sinoatrial node. So sinoatrial node rate would increase, the pulses that are generated would increase. Then coronary arteries, the arteries that supply the heart, will dilate so that more blood can go there. Of course, if the heart is going to work harder and faster, it would need more energy as well. So coronary arteries have to be dilated. You cannot ask the heart to work faster and constrict the coronary artery. You're going to kill it. Muscle of the heart, the force of contraction of the muscle would increase. This is why we feel palpitations. Palpitation can occur because of many reasons, but one of the reason is sympathetic system where the muscle's force is increased. This can also increase if we have heart that is more relaxed and fills more and has more fluid or blood in it, then it would contract with force as well to push that blood out, and that would also be a palpitation. But in under the sympathetic system, the palpitations are because one, the heart rate is increased, and number two, force of contraction is increased. So heart is going boom, 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 and you can feel it. Palpitation is when you can feel your heart rate or your heartbeats. On the parasympathetic side, we are sending blood to GIT, to our gut, to take the food and the nutrients and bring them in the blood and take them to the storage places. We don't want the heart to go fast. So heart rate is actually reduced. And the blood vessels to the coronary are still dilated. We don't want heart when the heart rate is reduced and heart is functioning less. If it is functioning less, its own blood supply can become less as well. So we keep the blood vessels dilated. Force of contraction will reduce with parasympathetic. Again, when you're eating. Now, I have a question for you. When we are eating, we start after eating, we start feeling sleepy. Remember that what we call it, um, food coma. So think about it. Why do we get food coma? I'll give you a hint right now. When we have food in our stomach, we send a lot of blood to the stomach, and stomach would extract hydrogen to make acids from the blood, and blood will be left with the basic ion. So you take H2O and carbon dioxide, you make H2CO3. From there, you take hydrogen out. You are left with HCO3, which is a base or alkali. Hydrogen is consumed to break down the food. HCO3 lives in the blood. That is an alkaline environment that makes us sleepy, and it is intentional. Why? Because your body wants you to sit down. It doesn't want you that you have just eaten food and now go and spend all that energy. This is like you're given $100,000 and you go out and just buy a car right away. Body wants you to sit down, relax, let that energy be extracted and stored. This is why there is food coma. This is why there is low blood pressure. There is low blood heart rate and so on. Body wants you to relax. And this is why, soon after eating food, we should not try to stress our body because it would damage it. If you try to run the muscles soon after eating the food and the blood supply has gone to GIT and the muscles have less blood supply, they have less nutrition, and you are making them work, they can get damaged because of the acidic environment that would develop. Okay, how about respiratory system? What do we want from our respiratory system when we are running? We want to breathe better. So, what do we want with the airways? We want them to open up. So, under the sympathetic system, the bronchi will dilate. Bronchi are the big airways, they'll open up. And under the parasympathetic system, they constrict. Now, blood vessels of the lungs, they also are mildly constricted in the sympathetic and do not know if they're really dilated or they get to the opposite side. One reason for the blood vessels not to become dilated during the sympathetic outflow is we do not want the lungs um, glands to start secreting too much, because that would cause congestion. So we just keep the blood flow under control. So far everything is kind of logical. You're running away from a lion. Your eyes are set for far vision. Your muscles and your blood pressure is increasing. Muscle tone will increase, you would see later. Blood is given to the muscle. The heart is pumping fast. Skin has the goosebumps on it. we are sweating, GIT is working less, bronchi have opened up, and we are breathing better. GIT. So think about it. We are running away from a lion. Do we want our sphincters to open up? If a sphincters are those ends of our GIT, for example, anal sphincter, right? Or the urinary sphincters. If the sphincters are open, we're going to start pooping. Do we want to poop when we are running? No. So what happens is, if we do not want the sphincters to be open, we want them to be closed, then we have to do one more thing, and that is we want the GIT not to function, or not to function too much. Why? Because when the GIT functions, it produces secretions and it causes motility. And motility would make the food and substances get out towards the sphincter and put pressure on the sphincter to say, let this be ejected. And here we have decided that we don't want the sphincters to be open. Then we don't want the GIT to be pushing food and stools towards the sphincters. So to compensate, the GIT muscle activity will reduce in sympathetic system. GIT secretions will reduce in sympathetic system, but sphincter muscle will contract. Because our body knows that, hey man, I have closed the sphincter, I don't want the GIT to be pushing anything. So the remaining GIT, non-sphincter muscles, major bulk of the GIT would not function very fast. And this would be reversed in parasympathetic. In parasympathetic, we can relax the sphincters. That would allow the GIT to move fast and move things and create secretions and create fluids and digest food and then remove it. So very simple logical system. So sympathetic system, sphincter tone increase. This is why also there is these expression that, hey, he became so scared that you could hear his sphincters close. When we are in fright, flight type mode, our sphincters close. I don't think we can hear them, but they do close. Sphincter tone increases. Lumen of the GIT, that is, the muscles in the walls of the GIT, they reduce their peristalsis, they reduce their activity and their tone. Logical. Parasympathetic, it will go the other way around. Sphincters will become less tonal, that can mostly they can open up, and lumen and peristalsis in the walls of the GIT would increase. That is a function of the parasympathetic system to help you rest and digest. So this is the most important part under control of parasympathetic system. Increasing your GIT's function. Increasing secretion. You do not want to run the GIT with no secretions. That is like running a car without oil. So you have to increase secretions, and then you have to pump the GIT so the food particles are broken and they are mixed with the secretions and we can digest it. How about that? What a logical system. Okay, continuing. That is GIT. What do you think would happen to the liver? What is happening in the sympathetic system? We are running. If we are running, we need glucose. Who needs glucose? Muscles. So what would liver do? Liver should make more glucose. So liver would start breaking down the stores of glucose. So glucose will be released. Glycolysis would occur. Number one. Number two, if there is any glucose present, it is going to start metabolizing and giving that over. At the same time, the bile system will relax so that the bile flow can occur. Parasympathetic, there is slight glycogen synthesis. Opposite of the making glucose available is to store glucose. That is called glycogen synthesis. So in the parasympathetic system, when we have eaten food and we are resting, the liver is going to start storing by doing glycogen synthesis. So imagine if the liver is the fuel tank of the body and the car is running fast, the liver has to provide fuel. And if the car is stopped or at a gas station, then liver has to get stored food. So that is a difference. I love the system, parasympathetic and sympathetic system and their behaviors. Kidneys. What do you think would happen? Sympathetic system. Do we want to make more urine when we are running? No. So not only we relax our bladder, so the feeling of urination or the urgency to urinate would go away. We also reduce making urine. This is why when we are under stress, we don't even know and we go hours and hours without needing to urinate. And as soon as we relax or come out of that, whatever exciting and stressful thing is, we start feeling, oh man, I need to go to the restroom. So, what is happening here is less urine production and increase renin production. Renin angiotensin system, you know that would increase blood pressure. Parasympathetic system, nothing on the kidneys. Ladder, running away from the lion. Just like we don't want to poop, we also do not want to urinate. And how do we urinate? In the walls of the bladder, we have a muscle called detrusor muscle. This muscle, detrusor muscle, contracts and kind of pushes on the urine to create the feeling of needing to go to the restroom. And then when we go to the restroom, it helps us open the sphincters and then move the urine out. At the same time, there is another muscle area here which is called trigon. Trigon is going to do the other way around. What it does is when trigon is contracted, in here in the mouth, on the two ends of the trigon are ureters attached. So when trigon contracts, it kind of pulls on this area and closes the ureters. So you could relax them, and that would cause the ureters to open up. Now, do we want the trigon to be relaxed during a running session? No. So the trigon is contracted so that ureters are blocked from bringing more urine in. Kidneys are said to make not more urine. So kidneys are reduced, not blocked. Ureters are blocked to bring in the urine. And then bladder is relaxed so that we don't have the feeling of needing to go to the restroom. Of course, the parasympathetic system is the opposite. The detrusor muscle would contract, that would make us feel we need to go to the restroom. Of course, then the the trigon would relax, opening up the ureters and bringing in the urine. Penis. And this would also go for the clitoris in women plus vagina. So, in case of the erection, this is the interesting thing. So, you would think that maybe erection is sympathetic system because sympathetic system is doing all the excitation. But imagine a lion is chasing us, and do we want to have an erection at that time? That would be totally pervert, and people would just make fun of us. And we would, if we die, they'll say, well, he deserved it. He had an erection when he was running. So here, what happens is erection is under control of parasympathetic system. So it is a function during the resting time. Ejaculation is a sympathetic function. So at the height of orgasm, when the time comes for ejaculation, that is under control of sympathetic. But do you know that sympathetic activity actually takes erection away? So if there is a man who is erect and you tell them something that excites them, the erection is going to go away. Now, erection in parasympathetic system is based on, this is the only place, nitric oxide. And we have done the nitric oxide discussions in the past about the vasodilatation with nitric oxide. Nitric oxide molecules help with the relaxation of the smooth muscle cells in the blood vessels. Parasympathetic system causes blood vessel dilatation in the penis by nitric oxide production. This is why Viagra works, because that is a nitric oxide producing or analog of the nitric oxide. Not really the nitric oxide. It is a cyclic GMP producer, which is kind of an analog or behaves like nitric oxide, and the erection can develop. So what happens is under the parasympathetic system, nitric oxide is produced that causes the blood vessels to open up, the arteries to open up. And interestingly, when the arteries open up, they bring the blood in the penis. And as the blood starts coming in the penis, it would start filling the spongy muscles, and penis would start becoming dilated or bigger. And as it is happening, that extra blood would cause pressure on the veins, and veins would start closing, and now engorgement would occur. This is not called congestion. Congestion is, for example, lungs got congestion. Congestion is when fluids come out of their physiological spaces and they cause a problem. Here, we are deliberately closing the veins. The outlet of the blood is closed, inlet is dilated. That brings more blood, but blood has nowhere to go. So, where would it stay? In the penis. That causes the penis to erect. Then comes the sympathetic system, and that causes the orgasm and ejaculation, and then the reverse would occur. So that is the now same thing. Clitoris, blood supply of the clitoris is increased because of parasympathetic system, and the erection of vagina occurs because of the parasympathetic system. Okay, so continuing. Blood. What happens to the blood itself? So, under the sympathetic system, blood clotting and coagulation factors are mobilized more. Blood has a better propensity to quickly clot. Why? Because we are excited, we are running, so we might actually get injured. We are warring, we are frightened, we are fighting, and so our body, our blood system should be ready to clot the blood if we get injured. So blood coagulation increases. Glucose in the blood increases, of course. We would put blood in the glucose in the blood so it can go to the brain and it can go to the muscles and be used. Lipids will start increasing in the blood, again because lipids can be used for the energy. So we are making energy available. We are running the engine, which is liver, to make more energy as well. We are using that energy in the skeletal muscles, and we are using that energy in the brain. Now, parasympathetic system does none of that. It doesn't even reverse it. It is not that during the parasympathetic activity, coagulation goes down. It just doesn't do anything. We stay as we are. But in the case of sympathetic, these are the changes that appear in the blood. Then, basal metabolic rate, our basal energy level production, our basic energy production goes up everywhere. That is why we start becoming hot, we start feeling hot because all cells are making more energy. Liver is providing more energy and fuel as well. So basal metabolic rate increases, our engine revs up faster. Under the sympathetic system, 100% increased. Parasympathetic system, nothing. Not that it reduces it, nothing. Suprarenal glands, the glands that are sitting on top of the kidneys. The center of these glands is called the medulla. Medulla is composed of, we had that discussion in the autonomic nervous system anatomy yesterday. Medulla contains rudimentary neurons. And when the sympathetic system comes and relays on the medullary cells produce norepinephrine and epinephrine, and they release that in the blood. So blood will have epinephrine, norepinephrine, and as I said before, epinephrine, norepinephrine will then go and do vasoconstriction and cause heart rate increase. They can increase the heart rate to double in 2-3 seconds. So that epinephrine and norepinephrine epinephrine is primarily coming from adrenal medulla. Parasympathetic system does nothing. Brain. Of course, in the sympathetic system, all we want is muscles to work and brain to work. So brain's activity, brain's acuity, brain's smarts, brain's alertness all increase. Brain is eating a lot of sugar and becoming just supercharged and super active. So brain activity increases, parasympathetic nothing. Not that it reduces the brain activity. So the question once again, if parasympathetic doesn't do anything to the brain, then why when we have eaten food, we have that coma or sleepy situation? That is not because the brain activity is low. That is because we have more alkaline environment, because we have extracted the hydrogen ions from the blood for digesting the food. An alkaline environment makes us sleepy. And do you know why it makes us sleepy? Remember when we go to lie down, our blood, our body's state is in a relaxed state, and our blood pressure reduces and blood flow reduces and the heart rate reduces, which naturally causes more alkaline environment to be developed. And so brain considers that to be a relaxed state and thinks that we should go to sleep. So when food causes alkaline environment, which is called alkaline tide, when that occurs, brain thinks, oh, time to sleep, and starts making us go to sleep. Okay, skeletal muscle. This is the hero of the sympathetic system. For the parasympathetic system, GIT is the hero. For the sympathetic system, skeletal muscles are the hero. So, of course, everything is for them. They are protecting us, they are running, they are helping us run, not the muscles themselves are running. So, sympathetic system, muscle would have increased glycogenolysis. What does that mean? The glycogen, the stored glucose, is broken up and used. Interestingly, muscles are, they look like fish and they are selfish. Why are they selfish? They break down glucose or glycogen, which is stored form of glucose, but they never release it in the blood for others to use. Liver, when that breaks down stored glucose, it releases it for others to use. Muscles are selfish. They say, man, I will break down glucose because I need that from the stores, but I'm not going to send it to anyone. I am going to use it. So glycogenolysis would occur, stored glucose will be mobilized, but will be used in the same muscle. That is why the muscle strength would increase. Muscle tone would increase because muscle has just more energy. Plus, of course, generally the brain activity has increased, which causes increased arousal of the system as well, which increases the tone in the system. Parasympathetic system, nothing. It doesn't increase or reduce, it just doesn't do anything. Last part, fat cells. What do you think they should do? Sympathetic system, fat cells would quickly release the lipids from inside of them to say, all right, extra energy material. So lipolysis, lipid breakdown will occur, and the lipids would start coming out, just like a candle that has those little fatty things dropping off of them. Imagine this little fat cell is melting away. So it's really not melting away, it is releasing the fats. So lipolysis would occur. Parasympathetic, nothing. So in my excitement, I picked a wrong thing. So these are the functions of the autonomic nervous system. Now, what is left here for our further discussions? Number one, I deliberately did not talk about the receptor alphas and betas and adrenergic and cholinergic receptors and muscarinic and nicotinic receptors. That in itself is a huge topic. And the second thing is the dysfunctions. I'm going to skip receptors altogether. For medical students, I'll do that lecture separately at another time. I'm going to now go towards the autonomic dysfunctions and then relate it to COVID autonomic behaviors. And then hopefully we can understand better why are those symptoms and then how to manage them. This is the discussion for today. Please do me a favor, like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can buy me a coffee, you can become a patron, or you can use PayPal. Thank you very much. I'm laying the foundations for us to understand these problems a little more. I would see you in a few minutes.